Hey guys, so we are back again. Dr. Adarsh, say hi.
Hi.
So we are back again, and today we are showing you a new way to treat scars. So Dr. Adarsh, what procedure are you doing right now?
So right now we are doing surgical scar revision. So in this particular patient, he got injured in an accident. So he got a big, long, accidental scar on the temple area at the right corner of the eye and upper portion of the eyebrow, and he got fibrous bands also in the forehead area, nose area. So there are multiple of scars. You can show it properly. So here you can see the forehead, this nose area, this upper eyebrow area, and the side of the eye and this temple area. So we are doing it with the help of this scar revision surgery, and although scars are favorable and they are wide enough, so after this surgery one can expect a single linear line, a very tiny line in this particular area, and that can be treated non-surgically with the help of lot of silicone gels and CO2 lasers and PRP. So this will give you a very good immediate result, and one can expect 100% results after 6 months.
Right. So guys, whether your scar is favorable for surgical or non-surgical, that the doctor will only tell you after a consult. This is something which we cannot judge by just by seeing pictures. So surgical scar revision is a part of acne scar treatment, because most of the times along with acne scar also patient has some scars that need to be treated surgically. However, in this particular case, these are accidental scars, and you can see they are almost really close to the eye or above the eye, and will be treating all of them. राइट नाउ हम लोग सर्जिकल स्कार रिविजन कर रहे हैं, जिससे बड़ा स्कार छोटा होकर एक पतली सी लीनियर लाइन बन जाएगा, एंड फर्दर दैट लीनियर लाइन कैन बी ट्रीटेड विद द हेल्प ऑफ CO2 एंड माइक्रो नीडलिंग एंड PRP. सो आपको कोई दर्द हो रहा है? हाँ जी, राइट. सो यू हर्ड द पेशेंट गाइस, बिल्कुल भी पेन नहीं हो रहा है, हार्डली